Dr. Becky here. In this video, we're going to talk about some common relaxation strategies and practices. So our goal is to help reduce some of that sympathetic nervous system overreaction to help create more of a quieter mind and a quieter body. So I want to talk about some techniques that have good research support and also that are portable once you learn how to do them. So first one is deep breathing. That's the one most people have heard about. It's extremely portable. It can be extremely effective. Learning a particular breathing technique that you find works for you, it should be in everybody's stress management toolbox. And there is a video that talks about some of the different principles about breathing, deep breathing, and also some strategies. So the next one is progressive muscle relaxation. That's an oldie goldie that a lot of people have heard about. It's a systematic type of technique that focuses on the body. So it's an active technique as compared to many that are more mentally active and not so much physically active. And so you focus on some of the larger muscle groups in the body and you actively tense those muscles. So you might actively tense some of the muscles and then you release them. And part of the value of that is, one, you get to become more aware of what it feels like when the muscles are tense. And there is a sense of release when you let go and a feeling of well-being and looser, more relaxed muscles. You do need some education to do this particular technique. There's lots of options on YouTube. There are CDs, there are books that can help you learn this. Now, after you learn it, you, as always, should have an ongoing practice because that's what makes it most effective. But then it can become portable in that even in a few minutes you can relax some of the major muscle groups. So the next one is autogenics, and this is also a systematic type of technique focusing on the body, but this time it's much more passive. You use mental focusing on different body parts as well as specific statements. The idea is to gently, using your powers of mental focusing and imagery, to help the body develop symptoms of relaxation, including sensations of warmth and heaviness. There's good research for autogenics, and particularly it has been found to be useful for people with chronic pain and for sleep problems. Now, if you're going to use any of the techniques for sleep or for pain, for example, I recommend that you don't begin your practice there, so you don't start using any of these practices at bedtime, for example, right before you go to sleep. If you do, you're going to try to make something happen. You're going to find it a lot harder to have an allowing attitude, which is the power source for relaxation techniques. So the best strategy is to have a practice maybe in the morning that you do over and over again until it becomes an old friend. And once you are seeing good results with that, then you might be able to then move it into bedtime or for use when you're in more pain. So this is a good strategy, though, and there are some good books out there about using this for those particular conditions. Now, the next one is meditation. There are multiple kinds of meditation. In general, you can say there's what we call concentration practices, and there's mindfulness practices. Concentration practices uses an anchor that's neutral or pleasant that you can repeat over and over again. This can be a word, a phrase. Many people use their breath. If you use your breath, the idea is not to control it like you might with some of the breathing exercises. It's just simply to use it as an anchor to observe and notice the breath coming and going. I'll be doing a video on concentration meditation and take you through a practice of it in a future video. Mindfulness adds to that focusing. It's about paying attention, but it's more about being in the present moment, using an anchor to help bring us into the present moment, and is much more expansive in terms of including our experiences and not just focusing on the anchor. I'll be doing several videos about mindfulness. So, as always, routine practice is a key, and you can do anywhere from a few minutes to a 10 to 20-minute practice a couple of times a day, which Dr. Herbert Benson recommends. Also, be aware that when you're doing your formal practice, and that is when you're sitting down with the intention to do one of these practices, that you want to be in a quiet environment, shutting off your devices, being in a quiet environment, getting into a comfortable position, then beginning your practice, and of course, remembering that you always do it with an allowing attitude. So these are just an introduction to some of these techniques, and we'll be talking about them in more detail in future videos.